Colaborat și domnul Belu îmi pare că l-așa înregistrat deja și o să mergem înainte cu subiectul ăsta. Și am avut acele discuții pe finanțarea anesteziei, da, includerea în pachetul finanțat de către CNAM. Da, și înțeleg că s-a reușit lucrul ăsta din momentul vizitei noastre. Dar am vrut astăzi să vedem pe celelalte subiecte unde suntem, ce propuneri adiționale sunt și cum poate Comisia Parlamentară să susțină acest sector mai mult, reieșind din solicitările, opiniile dumneavoastră și în colaborare cu experții OMS. Așa că vă rugăm mult să avem o discuție cumva așa informală, productivă, reieșind din necesitățile care sunt și cum am putea noi să vă ajutăm pe viitor. Mersi.
May I? Thank you. Bună ziua, and really I just wanted first of all to say that it's always a great pleasure to be back in this house, and as you all remember, last time we were here with our regional director, and indeed indirectly this area of work was touched upon as cancer treatment. You were talking about national program, cancer program control, but what Moldova is supporting the refugee response with is also treatment of patients, including cancer treatment and other costly treatments that Moldova is providing for refugees. In this sense, I'm very glad to present you our WHO mission that is here with us since 2 days ago, and some preliminary findings we will present to you today in terms of what can be done from our side, from WHO side, to support Republica Moldova in responding to this crisis, and what can be done also in supporting a country to launch and to endorse actually this national program, cancer control program. I would like to thank Ministry of Health and to thank Institute of Oncology and also Parliament for hosting us today. I think that we have also connected director of the Institute of Oncology, so I think that, yes, I would like to pass the floor to him if you allow me. Thank you.
Thank you very much.
Stimate domnule Dan Perciun, președintea Comisiei Parlamentare, stimați membri ai Comisiei, stimate domnule Ion Prisacaru, secretarul de stat, stimat doamnă doctor Miliana Gribici, este un privilegiu și onoare ca această masă rotundă privire la rezultatele misiunii de răspuns rapid a OMS să fie organizată aici în incinta organului suprem a Parlamentului Republicii Moldova. Aceasta demonstrează încă o dată importanța majoră care trebuie acordată problemelor de cancer control în Republica Moldova, dar și cu impact regional. Aș vrea să-mi cer scuze că nu sunt prezent fizic, dar pandemia, pe lângă toate lucrurile rele, ne-a învățat și unul bun de a lucra la distanță și vă asigur că împreună cu colegii și cu experții și partenerii noștri am participat la inițiere, programare și realizarea acestui program. Am avut o perioadă încărcată cu lucru intern, dar și cu o serie de întruniri, vizite externe. Comisia Parlamentară, asta deja este a 3-a întrunire în timp de ultima lună, deci unde împreună cu Ministerul Sănătății, cu CNM-ul, au fost discutate aspecte normative, legislative și ajustarea lor pentru îmbunătățirea activității noastre. Cu Ministerul Sănătății am dus lucru operativ, dar și de perspectivă cu doamna ministru, cu toți secretarii de stat ne-au vizitat la Institutul Oncologic, doamna Bezvehnic pe probleme de programare a chimioterapicilor, care este un proces foarte complex. Domnul Prisacaru Ion, care este președintele Consiliului de Administrare a Institutului Oncologic, cu care am discutat detaliat activitatea noastră. Doamna Svetlana Nicolaescu, de asemenea, a vizitat instituția în contextul discuției Programul Național de Control al Cancerului 2016-2025 și în special planul de activitate pe următoarea perioadă. Au fost o serie de întruniri și vizite cu prezență, dar și online, cu o serie de experți, OMS, domnul Alexandru Voloc, JICA, ECOASCO, Organizația Europeană a Institutelor de Oncologie, Ambasada Franței și altele. Toate aceste acțiuni au deja continuitate. Spre exemplu, ieri a fost aprobat hotărârea de guvern care prevede extinderea volumului de servicii medicale prestate populației din mijloacele Fondului de Asigurări Obligatorii de Asistență Medicală. Unele din aceste prevederi au fost aprobate inclusiv ca urmare a solicitărilor Institutului Oncologic, dar și cu suportul partenerilor noștri. Deci, din ele fac parte acoperirea anesteziei în afara sălii de operații pentru proceduri diagnostice, endoscopice, puncții, lărgirea indicațiilor pentru investigații costisitoare, așa ca PET-CT, protezarea oculară, protezarea individualizată maxilofacială și altele. Stimați colegi, războiul din Ucraina are un impact uriaș asupra activității noastre la Institutul Oncologic, activitate care este probabil una din cele mai complexe în sistemul medical. Pe lângă creșterea numărului de pacienți, au apărut probleme imediate de aprovizionare cu medicamente, gaze medicale, produse alimentare. Toate acestea se suprapun pe probleme cronice care există de mulți ani în lanțul de cancer control în Republica Moldova. Este de menționat că în speranța că chiar astăzi să termină război și noi toți ne rugăm în acest sens, criza este deja lansată și ea va dura. Pe lângă cei 160 de refugiați înregistrați cu cancer la ziua de astăzi, numărul lor crește. Și din cei 100.000 de cetățeni ai Ucrainei refugiați vor apărea noi pacienți cu cancer. Războiul a creat deci multe probleme care vor dura pe o perioadă. Deci tot ca rezultat a întrunirilor menționate are loc și această misiune de identificare necesităților urgente, dar și de perspectivă în cancer control. Experții au avut ocazie să facă cunoștință îndeaproape cum procedăm cu pacienții refugiați, chiar s-au întâlnit cu o parte din ei, așa că nu mă voi opri la acest aspect. Un lucru vreau să menționez aici, că mai puțin de jumătate din refugiați care le-am propus relocare în țările Uniunii Europene, din diverse motive, au refuzat să meargă la tratamente, deci motive ar fi limbă, familia, sunt mai aproape de țara lor. Unii au vrut chiar să plătească singuri. Deci aceasta, pe lângă acceptarea unui număr mare de refugiați în Moldova, majoritatea aflându-se în familiile noastre, vorbește încă o dată despre valorile noastre umane și vocația europeană a poporului nostru. Și a doilea obiectiv al misiunii a fost un suport pe termen lung de reevaluarea planului Programul Național de Control a Cancerului și în special trasarea planului de acțiuni, costificare și aprobarea planului pe perioada următoare. Aici ne-au interesat în special opinia experților asupra formulării unui centru de referință în cancer control, deoarece noi suntem la moment instituții terțiare, dar acoperim mai multe activități, screening, deci centru de referință pentru diagnostic morfopatologic și alte domenii. De asemenea, ne-au interesat aspecte de ameliorare a screening, diagnostic, tratament, programarea procurării chimioterapeuticelor, cancer registru și altele. După cum spuneam, am avut o perioadă încărcată, dar ne așteaptă una și mai intensă, deoarece ca rezultat, inclusiv acestei misiuni, va fi nevoie de reevaluat planul de acțiuni și de trasat măsurile pe perioadele următoare. Dar a venit primăvara, se încălzește afară, se lungește ziua, se apropie Paștele și pacea se va instala într-o bună zi. Sper că recomandările experților vor veni să sporească părțile tare ale Institutului Oncologic, să contribuie la remedierea punctelor slabe. Despre acestea am vorbit ieri în intervenția de pe medplatform.md, care este accesibilă public, nu mă voi opri la ele. Cel mai bun criteriu al activității noastre va fi că atunci când un pacient, o persoană, va intra pe ușile Institutului Oncologic, deci el va răsufla ușurat, că aici el va fi ajutat, aici el va găsi suportul necesar, iar pe de altă parte, angajații ar vrea să vină și să lucreze la Institutul Oncologic, să dea și odată veniți să contribuie la prosperitate și dezvoltarea domeniului și să vrea să rămână, să nu plece din Institutul Oncologic. Vreau să aduc mulțumiri, în primul rând, colectivului Institutul Oncologic pentru muncă, dedicație, suport al refugiaților, dar și pacienților din țara noastră, Comisiei Parlamentare, președintelui Dan Perciun, dar și membrilor, colegilor mei din această comisie, Ministerul Sănătății, personal doamna Ala Nimerencu, OMS, reprezentantul în Republica Moldova, dr. Miliana Gribici și grupului de experți. O să-mi permit să-i numesc pe fiecare în parte, domnul Andrei Eldoavi, Felipe Roidberg, Filipa Azevedo, Maria Lasiera Lozado, Rolando Camacho și Taia Iachimcova. Stimați colegi, vă mulțumesc pentru atenție, succese tuturor și sănătate și pace. Eu îmi cer scuze, mă voi deconecta pe
Da,
timp.
domnul Baltaga, mulțumim mult, vă așteptăm acasă și trecem gradual la punctul 2 de pe agenda. Doamna Rotar, vă rugăm să faceți o scurtă prezentare a raportului. Vorbim despre perspectivele de dezvoltare instituțională ale Institutului și despre Programul Național de Cancer, așa anumite sinergii care ar putea fi valorificate reieșind și din oportunitățile apărute la moment.
Cer scuze din așa. Mă simt flatată și mă bucur foarte mult să fiu în acest grup de lucru aici. Sunt parte a echipei Institutului Oncologic în calitate de consultant pentru anumite sinergii sau priorități care putem și prioritizări care le putem aduce în activitatea Institutului Oncologic. Prezentarea am făcut-o în limba engleză, știind că este o misiune a înalților oaspeți din partea Organizației Mondiale a Sănătății, din care motiv o să continui în engleză. Bănuiesc că majoritatea celor care sunt prezenți aici vorbesc limba engleză sau este traducere care o să ne ajute. Dear guests, I have joined the team of the Institute of Oncology quite recently in the capacity of a consultant in international project management or foreign assistance management, and I'm trying to support the Institute with prioritizing activities and creating synergies between different management tools and different strategic tools existing in the country and in the sector, so that the activities of the Institute are more consolidated and bringing more output. This is actually, this activity was mostly generated by several prerequisites which I identified within the Institute, mostly because there are many sections, subsections, departments, and a lot of initiatives and ideas coming from different aspects of the activity within the Institute of Oncology, and all of them are named projects, international projects, trans-border projects, transnational projects, national projects, and we identified a need to have a synchronization of all these efforts so that they tackle and they address those priorities which are set in major strategic documents existing in the field. And we know that there is a national cancer control program and action plans to it. Okay, thank you. And at the same time, with the most recent, relatively recent coming into portfolio of the director of the Institute of Oncology, there is a revised management program for the institution. And it was clear we need to strengthen all these capacities, we need to synchronize all the management tools so that at the end the system comes with an accountable system of implementing external assistance, national assistance, of implementing the action plan residing from the National Cancer Control Program, so that they have ownership of all the results. And from here, it was clear that the tool that we need to create, we call it log frame, just to avoid stronger words like strategy and so on, or policy. It is an internal document. It is an internal tool within the Institute, but it has very clear goals. One goal is to streamline all activities according to strategic objectives set in the National Cancer Control Program and according to the management program of the management of the Institute, to prioritize areas of intervention, because sometimes if you don't have synchronization of the results and efforts, you come up with vague knowledge where the efforts come more or less. So we need to have an idea what goes more in what direction and where is needed more, so that we come up with a prioritization of areas of intervention. And at the same time, it will become a tool to monitor and evaluate the results. At the same time, if we know how to prioritize interventions, of course, it will be a planning tool. So when we come up with a synchronized document to have the National Cancer Control Program and Action Plan to it on one hand, and the management program with the SWOT analysis on the other hand, we will be able to bring in projects, implement them, to set very clear goals, and to come up with efficient results. How is this is a draft, this is a summary presentation of the work done so far in this area, meaning that the tool itself is in process. It is elaborated in draft, it's a draft version. It is yet in the process of definition, and it will be shared with senior management and middle management of the institution, so that inputs are broad and the elements are tuned in a way as to make it more efficient. So here is what is the logic of the log frame actually. So we have the national program consisting of setting 5 specific objectives with indicators to it, which are smart because they are quantitative, they are measurable, they are time defined, and so on. And the action plans to it. So we had one approved action plan until 2020. Now it is in the process of approval, the next action plan until 2025. And the activities which are defined in the action plans are also analyzed through the prism of the management program of the Institute and through the SWOT analysis. Mr. Director most probably will or has already presented some ideas about the SWOT analysis, if I'm not mistaken, according to the agenda. But it is important to know that the SWOT analysis results from inputs of all sections of the Institute. There are sectorial or section reports which are filed on a regular basis, and the SWOT analysis is results from the inputs of this tree, so to say, the sections of the Institute. And at the end of all this, we populate the table, or we populate the tool with all the projects, so that we do not implement the projects first and then think what is the project good for. But we first see what the national program gives us, yeah, what objectives it sets, what indicators we have to reach, what is the vision of the management, how we have to implement it, and what projects we need to bring, and how we should streamline them to address the specific objectives of the program. This is just an example to illustrate the log frame as it looks now. And I'll give a concrete example. It is a proposed project. We call it umbrella project because it tackles several areas, and it is for the decentralization of medical services regarding the prevention, screening, diagnosis, treatment, and rehabilitation services, and palliative care of oncological patients. And the project will consist of several components, and every component tackles a specific activity of the action plan approved by the government for the National Cancer Control Program. So, for example, this umbrella project will tackle activity 261, which is the screening of oncological diseases, but at the same time, we added to it the Transnistrian component because there was a project which was submitted at the US Embassy to support the municipal hospital of Tiraspol, organize in a way the screening and the early diagnosis of oncological patients and consult them with the council, the specialized council within the Institute of Oncology. And specific objectives of the National Cancer Control Program consists of several subpoints, which in the log frame created or generated immediate objectives. This is the same wording as you may find it in the National Cancer Control Program, but in the document it is just another element to help plan this activity and to see how, to what objective, to what result it brings. Another activity, two other activities that are tackled by this umbrella project are on modernizing and building a regional system or network of oncological, of hospitals addressing oncological diseases or patients, and building two regional oncological hospitals in Belz and Cahul. This is just an example how all these elements come to one single tool where we can plan activities. I will not keep your attention to more details. We have something else to add or to mention. Aside from the SWOT analysis and other management tools existing in the Institute, there is also a lot of work done in terms of analyzing or assessing the needs and the resources of the Institute. And there is a well-known tool, four-color tool. It is informally called within the Institute. So it divides the resources and assesses the needs. With green code is what can be addressed, the problems which can be addressed with own resources. Yellow means it needs light internal adjustments. Orange means to be addressed with external assistance, and red code is this goal cannot be achieved. So everything is needed to be to achieve this objective. Just like an example. For example, in the urological section, all kind of onco-urological interventions are being conducted and so on. if we go to the yellow, there is some type of lymphomas, yeah, which cannot be treated because something is needed, and it clarifies exactly what is the need, which can be addressed with light internal adjustments. For the needs of external assistance, for example, interventional echograph in the urological section, something that needs external resources.
I'm sorry, if I may
assistance.
interrupt. I mean, great presentation, but I'm afraid it's not exactly useful in this format. It's good you will develop this tool to have it within the Oncology Institute. It will definitely help the management, and it will ensure alignment with the national program, and that is extremely important. We were wondering whether there are some conclusions that you have from the discussions regarding the program and where we are with that. But maybe we can move on to that after we have the presentation from the experts from WHO, their conclusions from the visit, and our particular interest here is to see what needs are in relationship to the refugee situation, but particularly with ensuring that we have the program in place, when we can have it in place. If we are not yet there, what do we need to do to be there? When can we actually be there? And so on. So this is interesting, but it's a bit technical, and it has to do more with the internal workings of the Institute. And for us here at the committee, we are kind of interested in slightly more high-level stuff. So if we could, thank you very much, and move on to the presentation from the WHO experts.
Am vrut să închid.
Da, prezentarea cum să o duc și... Nu știu, prezentarea noastră, credeam. Da, nu trebuia știa asta. Prezentarea.
Thank you. So first of all, dear President, Chair of the Health Committee, and dear members of Parliament, also greeting our esteemed Ruslan, Dr. Ruslan Baltaga, and everyone here involved. Also, we would like to thank the Ministry of Health. So first of all, yes, we are extremely grateful for having had this opportunity to come to Moldova and to respond to this request. And we are here essentially to support you in any way we can. And we will continue to do that even if we are not physically here. As we've seen now with Ruslan, this is very easy. We can continue our work together regardless of the distance. So it's been a great pleasure to be here and to be in the Institute of Oncology, meeting all of the colleagues working in cancer care. We've had great conversations and great discussions. Everyone has been extremely open in exploring what are the needs, what are the current capacities, what are the challenges, what's working well. And so we hope that we can provide a bit of an overview on these preliminary findings. It's been a mission of 2 days, so we cannot provide a comprehensive revision for the National Cancer Control Program specifically, but we've had great initial conversations, and we hope that we can continue these conversations. So this is just an overview of what were the mission objectives. As we've established, we came here to conduct a rapid needs assessment of the capacity of Moldova to manage cancer care for Ukrainian refugees, as well as validate a request for cancer medicines to be able to provide care for refugees, and to develop a process through which mechanism of procurement and service coordination can be coordinated with different stakeholders, and to begin discussions on the National Cancer Control Program, the revision of the previous action plan, the new action plan that has to be still approved, and the costing for this action plan. So to briefly introduce the team, there's two members that are not here today, but they've been with us until today. They're very important members as well. So Andrei Ilbawi, he's the Cancer Control Officer from WHO headquarters, and Taya Yakimkova, Project Coordinator from Eurasia Regional Program from St. Jude Global, from St. Jude Children's Research Hospital. Then here present today, we have to the left, starting from the left, there's Dr. Felipe Reutberg, Consultant in Cancer Management from WHO headquarters, Filipa from WHO Europe Regional Office, and Rolando Camacho, which some of you have already known previously, as he's been to Moldova many times already, supporting cancer care, and he's a consultant from the WHO Regional Office for Europe. And myself, I'm Mariela Sierra Lozada. I'm a technical officer working in the WHO Regional Office for Europe. This is a summary of the meetings that we've been having. So we've met with the providers from the Institute of Oncology. We've met as well with central procurement colleagues, National Health Insurance Fund, civil society, refugees, and with members of the Ministry of Health. So first of all, to look through a preview of the assessment of the capacity in Moldova. So in Moldova, there are about 14,300 cancer cases per year. And we see, when looking at the expected changes in premature mortality, we see that there's no changes, there's no expected changes compared to the SDG targets of 1/3 reduction and what we're seeing in other countries. We're seeing as well that there's a projection for an increase in cancer burden of 30 to 40% by 2040, and we see the risk factors, the influence of risk factors like tobacco, alcohol, and obesity, which is a challenge in Moldova. When comparing the current not only burden of cancer, but the mortality to incidence ratio, so the impact of cancer when you are diagnosed with cancer compared to other countries in the region, we see for cervical and breast cancer that it is higher in Moldova than in neighboring countries. And this is due to many factors, but we observe that in many cases cancer is diagnosed at a late stage, which then difficults treatment and reduces survival probability, as well as lower quality of care. And we observe challenges with completion of treatment and quality, as well as limited capacities, both in equipment, facilities, and human resources. So this provides an overview of the health system's capacity, and also just to put it in context, these numbers, all these data, is prior to COVID-19 pandemic. So it's prior to the effects that has had, which has challenged all healthcare systems across the world. So we can see, for example, in terms of equipment, if we compare with what is the median, number of CT scanners is much lower, 15 compared to 49, or when we're looking at number of surgeons, it's 368 compared to 848, or number of nuclear medicine physicians. So we see that there's a limitation in the number of workforce as well as equipment. So the National Cancer Control Program, as has been discussed, runs until 2025, but the action plan that covers the period until 2025 has not been completed or approved yet. And there's also, first of all, the midterm review of the implementation of the previous action plan is still pending. and then the new action plan has to be completed and costed. And WHO, we can support with this as well, with setting priorities for this action plan. So looking at the current response, we've seen, so first of all, it's really a mark of Moldova, and it's also something we've experienced. People here are so friendly and so welcome. And Moldova was one of the first countries to open the doors to people in one of the toughest moments in their life, in the highest moment of need. So there's an estimated number of 100,000 refugees residing here, and we've received reports that there's from about 140 to 200 refugees with cancer that have been presented to the Institute of Oncology, and about 50 refugees with cancer have accepted to be transferred to other EU countries. In terms of the political and cultural context, as I've said, we've really observed how the people of Moldova have welcomed and supported families, and we want to thank you for this great support that you've provided to refugees. And we have also seen that there's a desire from refugees to not be transferred and to stay in Moldova, which impacts decisions that have to be made in terms of providing care for them. And we've seen that there was a regulation that limits service provision, and this is important for our discussions. In terms of stakeholder response, globally we've seen a huge outpour of support for Ukrainian refugees. And so this is an important venue that can be tapped into as well in order to support Moldova, to support Ukrainian refugees. So this is something that we can discuss further as well. So as mentioned before, there was a change in the regulation. So cancer care at the moment is not being, according to our information, is not being provided to Ukrainian refugees unless it's an emergency. So we see that for emergency and COVID, this is covered, but for cancer care specifically, it is not. We've also observed that there's a mismatch of the numbers of refugees entering and leaving the country. So there's a challenge in flow of information and monitoring of refugees, as well as refugees having insufficient information. We've heard from them in terms of what are their options and the consequences of the decisions they have to take. And what are their rights if they are transferred to another country? What are their rights if they stay in Moldova? So this is all important to consider. So in order to decide what approach to take in this crisis situation, there's a pathway to make this informed decision. First of all, defining needs and how many cancer patients have arrived, what cancer types, how many are expected to come, and a lot of this information has already been done here in Moldova, and we've received already a lot of this information. And then having this information, from this information you can extract and assess what are the capacities that will be needed and what is the impact on the budget, and also what needs to be considered to strengthen the systems in order to absorb those needs. And lastly, but very importantly, dialogue with partners and donor engagement has to be considered to assess how much support you can receive, and then deciding from that, what option you can take. So we want to summarize two approaches. One approach would be that all refugees with cancer that enter Moldova are treated for cancer in Moldova, having the same rights as Moldovan citizens. This is an important point. They would have the same access and receive the same care as any other Moldovan person. The second approach would be to evacuate all refugees with cancer that enter Moldova. But if that is to be decided, then it's important to identify all refugees that have cancer that enter Moldova, which at the moment we think might not be happening, and then provide the information to those refugees so that they know what are their options and how long it takes for them to be transferred, what do they have to do to access this, etc. And it's important that if they're to be transferred, we've heard from some refugees waiting for transfer that they've waited for 1 month. So it's important that transfer is timely, as it is important for the treatment of the disease. And the third option is a hybrid approach, which requires, of course, strategic planning. So maybe, the first or the second approach is decided, but then not everything can be guaranteed, and then you can provide a hybrid response to this. So these are one of the main issues we identified, or challenges from refugees when hearing from them, is the difficulty in the navigation of the system. So here are some examples from Poland and Portugal on information that they provide online, also in Ukrainian language, so that Ukrainian refugees, when they're in Moldova, they know what their rights are. They know if they can access healthcare. They know if their children can access education. So all of these important points that one has to consider. So after having assessed what the current situation is, we move on to how, what are our main findings and recommendations. So one of the requests that we received tying to this current situation is a medicine list, a cancer medicine list, that we evaluated and we compared to the WHO essential medicines list and categorized the medicines according to how beneficial they would be to cancer patients. So you see that there's 4 different categories, the green one being the one that we would, that is found acceptable and would have the most impact, and the last one, the 4th one, being the one that would not be recommended to procure in Moldova. And so it's very important for cancer medicines, and I mean for all medicines, but especially for cancer medicines, as they can be quite costly, that there are priorities set in place. So there are some medicines that can have a huge impact and benefit on the health of the cancer patient. And these are the ones that are, so you see in green, and then there's some that would provide little to no benefit, and they're quite costly. And so these are the ones that are not recommended to be purchased. And you can see that it's important to have this prioritization, because if you include the ones in red, it would increase your budget by 50%, but would not add much benefits to the patients. And we want to emphasize the importance of acting now and investing in cancer care strategically. So by investing in a comprehensive cancer care approach, you can save up to 1,000 lives per year, or more than 1,000 lives per year. So it's really an investment that you put into your society. And it's not only that by investing in cancer care, you will see the projections of how many lives can be saved per year, but it's also that by not doing so, there's harms to that inaction. So you will have citizens that are dying when that could have been prevented, as well as all the consequences trickled down from that. And so shifting to the National Cancer Control Program, it's very important to consider cancer as a cancer control as a continuum. So there's many different aspects to it, and every aspect of it is important. So first of all, you have prevention. 30 to 40% of cancers can be prevented. So taking into consideration having policies to fight those risk factors like alcohol or tobacco, as well as those, for example, Hpv vaccine that can prevent cancer from developing, it's important. Then we have early detection, and it's very important that cancer is detected early enough, because that will improve a lot the survival and will reduce the suffering of the patient. And diagnosis and treatment, ensuring access to everyone, as well as quality and palliative and supportive care to make sure that our patients are not suffering. And along all of these different components of cancer control, it's crucial to collect data, because without data, you cannot know what is happening, what are your needs, what are the limitations, what's working well. You cannot know any of that if there's no data. So this is an important component. Yeah, So beginning with cancer prevention, we didn't cover cancer prevention in this mission. The only thing we discussed was HPV vaccination as part of cervical cancer in the screening session. So our recommendations for this would be, so we see that there's new regulation that expands HPV vaccines to girls and boys, but it is important, the most effective is to vaccinate girls. So it's very important to expand HPV vaccination in girls to prevent cervical cancer from occurring at later stages, as well as hepatitis B vaccine, which we didn't discuss, but is important as well. So for early detection, pretty much our discussion centered around screening. And screening is you basically invite all of your asymptomatic population, and you perform tests, and then you decide you're able to detect the cancer at an earlier stage. However, this is very costly and a huge burden to the system. And so before implementing screening programs, it's really important to look at early diagnosis of the disease and investing in early diagnosis. So we observed from our discussions that the investment has been predominantly in screening, even though for most of it, especially for breast colorectal, screening has been of low coverage and opportunistic. So our recommendation would be to revise a strategy for early detection overall, and to focus investment in early diagnosis programs. And for cervical cancer screening program, which this is one of the most established screening programs, and this can really prevent cervical cancer from occurring, to measure impact on stage at diagnosis, incidence, and mortality. For cancer diagnosis, we observed that the main cancer, the Institute of Oncology here in Moldova does not have CT or MRI scans or PET-CT scans. So the most important recommendation from our side on diagnosis is to revise the capacity and expand and increase the capacity for cancer diagnosis. Going further to treatment, in terms of access to medicines, we revised also the procurement chain for medicines, and as we've mentioned, most of the cancers are diagnosed at late stages, which has an implication on treatment, and it increases the cost of treatment and the survival of the patient. And what we observed is that there's a general, or what we heard was that there's a general problem with planning and projecting how many cancer medicines are needed. And this is not necessarily because of the current context or the current crisis. This is something that has been occurring previously. And because of this lack of forecasting and as well as not having sufficient budget to cover for the needs, we heard that there's up to 50% of treatment interruptions, and there's potential stock out. So at the moment, there's 13 medicines that are stocked out. And one of the main issues, as mentioned, is the limited budget availability. So in terms of recommendations for improving access to medicines, for cancer medicines, there's, first of all, the prioritization of what are the medicines that will provide the most impact to your patients, and this will benefit you in savings and resource reallocation, as well as we heard that there's an issue with storage, and that's why sometimes the projections are not so accurate because there's not enough storage. So there's some things that could be done easily, like supply of fridges to be able to store more cancer medicines so that you avoid stockouts. Then there's also some midterm strategies that can be done to improve access to medicines, like including it inside the costing of the National Cancer Control Program to ensure that all needed cancer medicines are budgeted, as well as looking into other alternatives, like the WHO Cancer Medicine Platform, which is being developed at the moment and could be a potential solution in the future for Moldova, as well as including clinical trials and research in the Institute of Oncology. When coming to treatment, to surgery as another component of treatment, we observed that there was a reduction in beds and procedures due to the COVID pandemic, as well as constraint of resources. So for example, there's one laparoscopy equipment available. So the main recommendations would be to increase the efficiency of the resources that are available. So for example, by reviewing the capacity and demand and optimizing minimally invasive surgery or anesthesia monitoring, as well as cooperating with international agencies and governments to improve the capacity. When it comes to radiotherapy as another component of cancer treatment, we observed that the total number of patients treated with radiotherapy in 2021 was 1,697 compared to the at least 5,000 patients that should have been treated. So we see that not all the patients that need treatment of radiotherapy treatment are getting it. So there's a lack of sufficient capacity to cover all cancer patients. And the waiting lists we observed were also long. So recommendations, on a short-term plan, one recommendation would be to apply to the International Atomic Energy Agency for funding to obtain the equipment that is missing or outdated. And you can start with those cheaper equipments that would cover most patients and would provide the most impact. And then in mid and long term to scale up according to underreporting of cases and to restructure education and training of the system. So for childhood cancer, we observed that, well, first of all, childhood cancer is not included in the National Cancer Control Program. And we want to make sure that it is covered enough now with the revision of the action plan. And we observed that it is not known in its entirety what are the current state of available resources, as well as that the cancer registry for pediatric cancer patients is combined with the adult cancer registry instead of having its own set of variables and indicators that it would be needed. So the recommendations would be mainly to, well, first of all, make sure that it's included in the National Cancer Control Program and take that into consideration for the action plan, and provide training of immunophenotyping, which that would be a great asset and would improve a lot diagnosis and survival of the patients, as well as assessing what are the available resources and what can be done to improve. For palliative care, we've seen that there's been a lot of progress in Moldova to improve access to palliative care in areas that are further away from the capital. So we see that now it's easier for family physicians to prescribe opioids, and that's a great improvement. However, we observed or we heard that there's some reluctance from the professionals to do that. We've also heard that supportive care services that are not provided by medical providers are not covered by health insurance. This is a very important point. So psychologists and nutritionists are not being covered, and this is an important component of supportive care. So in terms of recommendations, it's to continue with the great work that has been done to ensure that palliative care medicines can be accessed in the entire country, regardless of where the patient resides, as well as covering the cost for the entire supportive care within the health insurance budget. So for cancer registry, Moldova does have a population-based cancer registry, which is really great. And this has been really helpful to be able to assess what is the current situation and what can be improved. We do observe what might be some cancer cases not reported in the cancer registry, since it's not obligatory. So maybe the cancer cases that are being detected in the Institute of Oncology are recorded in the registry, but not those that are being detected in other centers. So it would be really important to have all cancer cases registered in the National Cancer Registry, and as well as having a separate registry for childhood cancer. And in terms of cancer care overview, and we've heard this already previously from the previous conversations already happening today, and this is one of the things here that we've observed in Moldova, that, you know, as we're here, things are changing. So even some of the things that we might be presenting can be easily, quickly outdated, because everyone is so proactive and wants to improve the situation in Moldova. So we see that there's no National Cancer Care Reference Center in Moldova, and there's no cancer care network in the country. And so it is very important to ensure that all citizens of the country, regardless of where they live, how far away they're from the capital, to ensure that they have quality access and care, cancer care, we would recommend that the Institute of Oncology becomes the National Cancer Care Reference Center in Moldova, responsible for leading the development of the national resource appropriate guidelines, as well as being in charge of the accreditation process of this cancer care network, and as well as ensuring training of cancer care professionals that are working in different institutions so that the highest quality of care can be provided all across the country. So to summarize, and apologies for the long presentation, but as you saw, we were here only for 2 days, but there was so much to discuss and so much to see and so much interest and engagement from everyone working here that we also felt like there was a lot that we had to cover in this presentation. So in the short term, Moldova has to decide an approach for what to do with refugees with cancer, so that there's no confusion and that it's very clear for both medical providers and also for refugees. Define the mechanism to implement this approach and establish a coordination system, invest in information systems, and in terms of emergency procurement, to ensure that medicines are prioritized, and for the action plan, as has been discussed already, to be revised and completed as soon as possible. In terms of immediate term actions, some of the recommendations we would suggest are to effectively implement the National Cancer Control Program through prioritization and costing, invest in organized early diagnosis programs, increase capacity of diagnosis, and for treatment to do resource-appropriate planning, for childhood cancer to make sure it's included in the National Cancer Control Program and establish a comprehensive registry, and for the National Cancer Registry to ensure completeness of data. So in terms of the way forward, we're very thankful that we had this opportunity to present these findings to you. And you have also a very important role here to ensure that Moldova has the best cancer care possible, and specifically for Ukrainian refugees also to ensure that they can have access to quality cancer care, whether it is here in Moldova or that they're quickly transferred somewhere else where they can receive this treatment. So we kindly ask you for your legislative interventions to support evidence-based policies and financial support. And it's also important to develop partner engagement. There's been a huge outpour, as mentioned, of international support. So there's so many resources, there's so many associations, there's so many international cooperation mechanisms that can be tapped into, that can support Moldova, not only to support Ukrainian refugees, but also Moldovan citizens with cancer by strengthening your health systems. And as well, it's important to keep, in this context, the refugees and community engaged in the decisions so that they are aware of what is happening and how it affects them. So even though we're presenting these preliminary findings here, our work continues, and we will be very happy to continue the support and engagement and collaboration with all of you here at the Parliament, but also with the Institute of Oncology, with the other cancer providers, as well as with the National Cancer Control Program Coordinator. So we will provide a report to the Ministry of Health, as well as provide technical inputs to the action plan, and support with implementation. So as WHO, we can support you to engage with networks and partners. As mentioned before, for this current situation, this could really make a difference, and we would be more than grateful to support you with this. Thank you for listening and for hosting us today.
Thank you very much for the presentation. and the findings and the conclusions and recommendations. I would perhaps want to dwell a bit on the timeline for some of the actions, as well as for the support that we can count on going forward. So with relationship towards the medicines and the estimations that you've done, were they based on the current number of refugees received, or so the 2 million for the most recommended medicines, what number of patients were those supposed to cover, and it is a yearly cost, and is it only for refugees or for other patients as well?
So there's several aspects to this question, and thank you so much for your question. So first of all, regardless of the number of refugees that you will have in the country, there's some medicines that we would not recommend, regardless of how many refugees are in the country or no refugees are in the country. Second of all, at the moment, so we were requested for support with medicines, but at the moment, cancer patients are not being treated. So at the moment, these medicines for refugees are in fact not needed because they're not being treated. So first of all, what would be really important to address is whether Moldova is going to cover the costs and provide cancer care for refugees. So that would be the first question. And then it would be very important, we have estimations of about 150 cancer patients. Does that include all cancer patients, all refugees that have cancer? Because those projections and forecasting would be really important to assess the medicine's need. So in terms of what you're asking specifically of whether, how many refugees have we included in the calculations? So we have not calculated this specifically because at the moment there's no refugees that are being treated.
Right, so, but there was an estimation of 2 million for the most essential medicines on the slides, and I was wondering where did that number come from?
2 million. So I will refer to Felipe, my colleague Felipe, who did these calculations. Thank you.
Distinguished, thank you so much for your questions, really relevant. These calculation volumes were based on an assumption, a list that we received from the Ministry of Health, validated by the Ministry of Health, that was sent to the WHO Euro office and headquarters whenever we were there in Geneva and in Copenhagen. These estimates came from our dear colleagues in the country that they made the volumes estimations for procurement. It's not specifically addressed to refugees. It's amount of 1 year procurement according to their definition needs. And I'll echo what my colleague just mentioned. To make this assumption more accurate, we should have the need and understanding about the volumes in need, the projections, to make sure not only we have the resources for this in the prioritization, but also we ensure, as we've seen, that all patients in need receive treatment for the period in need. Not only they receive, but they have no interruptions in treatment. So I'm quite sure that our dear colleagues that had this discussion with us today, they're able to reinforce this analysis, to review the volumes of number in needs, and to review this list. Here is an exercise to understanding from the budget allocation, how can we better support you in terms of understanding our colleagues, how can they better prioritize investments, save resource, and better allocate resource. That's our goal here, and that's why our continuous work will ensure that we will endure and perhaps provide you what's needed.
And the follow-up question on this, can we count on WHO's support for purchasing these medicines, or was the mandate here just to validate the request in terms of prioritization? Or is there also a possibility to have financial support in purchasing them? Or should we, or is the emphasis on finding this money within the state budget? So as just to be like very kind of forefront on this and understand exactly, is it a discussion we need to have next week when we are reviewing the budget? Is there a possibility for support on your side? Should we look for our other international donors? Like, what was exactly the mandate here? Was it strictly prioritization and validation of the request, or also, or in view of the possibility to finance this actual purchase?
Eliana? Okay, just to clarify opportunities here for procurement and support, financial support. WHO has the opportunity to help procuring medicines, cancer medicines. But first of all, you have an instrument for procurement in the country. You have an agency that does it. And so I think the first, from our perspective, is understanding how this process is currently functional, non-functional, and how your dear colleagues in collaboration with WHO country office can do a better map and to assess if this is now an opportunity or if you think reaching out at external partners would be better for your country. Secondly, from our side, we have a tender list. What is a tender list for those who are not aware? I'm sorry if I don't want to be a lecture about this, but just to let you know. We have a prioritization list that only medicines that are included in WHO essential medicines list could be procured. And for those, we have a specific list that we can act more fast for procurement. But first of all, just to make sure, there's a time for procurement. The international market has these medicines not available instantly. It's different from diabetes and insulin. So there's an international understanding how they can collaborate, these companies, to make sure in the right time you have these medicines available, not only because you have money, but you have instruments to have these medicines out timely. It can vary between 2 months, 3 months, so that medicines that are in stock out should look for an efficient procurement process to make sure you have these medicines available or an evacuation plan in process. So that's why it's so important, this assessment. Third point for your question, just to finish, so you have an agency, WHO can do, but only for the tender list. And the third option is that there are external agencies like UNDP, it's a UN agency, that in the past did a procurement for Ukraine, for example. So you have a few options that I think the best approach could be have this discussion internally with the expert from the Ministry of Health, the WHO country office, and according to the mandate, the WHO country office will coordinate this process. Liana, or you want to complement?
Just here to clarify, so can we expect financial support for purchasing medicines? Then for whom? For general needs or specifically for refugees? And if for refugees, I understand we need to make a decision that we are treating them, then estimate how many of these refugees would be, types of cancer, I guess, I'm not a doctor here, exactly needs, and then formulate a financial request of some sort. And that's one avenue, but that means there are funds available, but only for refugees, but then you need to take a decision on the refugees and how many of them. Or there are funds available, but also for the system itself and for Moldovan patients. Or there are not. And if there are not, there are not, and then we focus on the refugees. Or is there also availability for Moldovan patients to receive? And then it's a question of mechanism. How are they purchased? Through WHO, UNDP, or is it money coming into the budget from internal donors, and then we here locally through our agency do the purchasing? But the key question in my view is the financial availability of resources, and is it for refugees only? Is it for refugees and Moldovans? If there is clarity on that. If there is not, I mean, it's to be discussed.
So first of all, your question is excellent, and we have been exactly discussing these same questions that you're posing to us today. So really thank you for your frankness and openness, because these are the conversations that we need to have. And I think one important point is that as far to my knowledge, we have not really received clear and open requests of needing support to provide cancer care for refugees, financial support or other support. So this would be, first of all, making it clear whether you want to request this support, and if so, from WHO side, we can help coordinate with potential partners and donors to engage them. And it's an excellent opportunity. And then the question about whether this would be only for refugees or whether this would help strengthen the systems, I think it would be an excellent opportunity to strengthen the systems of Moldova. And it's a, in a way, I mean, it's a crisis that we would all want not to happen, but it's an opportunity that could be really explored, and from that sense, WHO is happy to support that, because it's not only money to buy medicines. It's also having the people that will provide that care and having the training, having the equipment, I mean, it's a lot of different components. And also I want to guarantee that in that sense, the head of the WHO country office has been advocating for Moldova at the regional level. So any requests and any way that we can support, we'll be happy to work together and to try to provide that support as much as possible.
Mm-hmm. Okay, so I think we will take this kind of discussion further with the ministry, because my understanding so far was that we have made such a request. As I understand, we have not, and then we need to have this discussion and see whether we lodge in the request and what exactly we are requesting. And also, so far my understanding was that we were providing cancer treatment to refugees, and apparently we are not. We are only treating what we call emergencies.
That is correct. And also I see Ruslan has his hand up in the background.
Just a quick intervention. From the beginning, we had a discussion what would be the involvement needed. So we were asked by WHO to count what would be the range of costs for a cancer case, which we have established 700 to 1,500 euro in case the decision to treat them, and then to find a source for them. But in parallel, we would need to increase capacities with regards to diagnosis and treatment, because Professor Bolat can confirm we have some projections that in 5-6 months we will run out of medications, and this is a huge problem in the past even, and a lot of unsatisfaction from patients come due to interruption of treatments. So all the ways were discussed immediate if we decide to treat money and the mechanism how we can receive them, and second, to make sure that even we have money, we have mechanisms to buy, and not just to increase the list and put the pressure on the system. Thank you.
But we are correct to understand that there has not been a clear request for financial assistance for treating Ukrainian refugees.
I think that this is some sort of misunderstanding, because Ministry of Health, on every platform, we describe that there are two possibilities to manage these refugees. One is to transfer them to third party, and the other one is to have the support for procurement of the drugs and to treat them here, at least for those refugees that do not want to go to another countries.
But right now the ministry has not yet taken a decision on which approach you are to follow. You are awaiting the approval of funds in order to decide the treatment will be made available in Moldova, correct? So your availability to treat patients in Moldova is contingent upon the availability of funds.
Right now we are in process of, so we established the procedure of transfer of the patients from Moldova in contact with, in context of EWRS, so early warning and rescue response system in Europe, as well as through the CESIS framework, so Common Emergency Communication and an information system, and so we are using these two instruments to organize the transfer of the patients from our country to other parties, as well as we received, at least from IOM, the confirmation that they are going to support treatment of oncological patients in Moldova.
IOM?
International Organization for Migration.
Yes. Mr. Grama, if you want to intervene, or colleagues.
Thank you. Eu doar vreau să fac o remarcă a unui mecanism care deja la moment este în lucru și poate fi util pentru a fi aplicat în cazul oncologiei. La moment se lucrează și cred că este pe ultima 100 de metri schimbarea numărului de priorități, sau zicem așa, intervenții care sunt acoperite de către Compania Națională de Asigurări, în special serviciile care se acordă în perioada antinatală și sarcină și toate patologiile ginecologice, care vor fi acoperite de către Compania Națională de Asigurări refugiaților, eu am în vedere serviciile acordate refugiaților. Ulterior, UNFPA va reîntoarce banii către companii conform unor facturi care ulterior Compania Națională de Asigurări le va duce o evidență separată. Probabil poate fi folosită această experiență și în cazul pacienților oncologici, în cazul în care se identifică sursa care ar putea acoperi aceste cheltuieli, fiindcă deja mecanismul este stabilit, Compania Națională de Asigurări a dezvoltat mecanismul de monitorizare și de raportare a pacienților din rândul refugiaților și în cazul ăsta cred că poate fi identificat și pentru alte categorii de pacienți. Mulțumesc.
Okay, so my suggestion would be to take this discussion to the ministry, have a meeting with the minister maybe as soon as possible, and whoever implements something similar to this, like reimbursement of actual costs or some other financing mechanism, if funds are available from WHO. If funds are not available for WHO, this is life, we'll look somewhere else. But just have a clear understanding of what's available here and where should we look in somewhere else if this is not possible. Then, so this is the refugee response. With the other aspects, when can we realistically expect to have the action plan costed, reviewed, so we can approve it? And again, what support is available, technical support, since my understanding is there is quite a lot of need for technical support.
Bună ziua și mulțumesc de întrebare. E adevărat, noi suntem în draft de plan de acțiuni. El deja a fost elaborat. Noi l-am elaborat încă pentru 2021, pentru 2021, dar el nu a fost aprobat la acel timp. Una din motive a fost și perioada de pandemie, calculele au fost diferite. Incidența, desigur că la acel moment era mai scăzută, e adevărat. Și motivul ăsta, de faptul că el nu a fost aprobat, pentru noi a fost o idee nouă de a continua prin a-l revizui încă o dată, a-l actualiza la cele particularități care le avem acum, post-pandemie, și să venim cu niște calcule, zic, mai reale, având în considerație și la moment finanțările care s-au mărit cu mult în multe domenii și așa mai departe.
When can we expect to have it?
Noi ziceam septembrie.
Or let's ask differently. What kind of support can WHO provide? First of all, I think a midterm review is very needed. It's probably not a good idea to have the program review itself. Not recommended. It would be good to have an external evaluation of where we are at the moment with these 5 years that have passed. So external midterm review would be great. And secondly, can we have technical support from WHO to finalize the plan maybe as soon as possible? And then also, eventually, for some elements of the plan, like what you mentioned with equipment, yes, we'll put it down in the plan, it's clearly needed. But if you can even kind of, in a simplified version, tell us what is needed, how much it costs, we could move quicker with some financing aspects, even if the plan is to be approved in September. So we could, because I wouldn't like to wait for September to start implementing some of the things written there. If purchasing equipment is one priority and then it's clear that we need to buy A, B, C, D, maybe we can start looking for the money sooner and maybe already buy the CTs or whatever. I don't know how much they cost. I expect they are quite expensive and it's not to be done easily, but still having a sum on the table even before the plan is agreed would be helpful. and so on. So what kind of support can we expect for the external midterm review and then for finalizing the plan? Da.
Doar o mică remarcă. Noi ne-am propus în jur de septembrie, având în vedere că lucrăm acum cu un voluntar care își dedică 2 ore pe săptămână, ne ajută cu costificare. Deci procesul...
No, this is too late, and voluntary work will not bring us where we want to be. Can we have...
Dacă o să avem alt suport, sigur că am prefera iunie.
Maybe, I think your expertise is extraordinary, and some sort of regular meetings on the existing plan with your feedback and that being incorporated will help. And I also believe external kind of eyes would be good, provides better objectivity.
So, first of all, thank you for your trust in us and in being able to support you. And we agree with all of the points that you've mentioned. And we'd be, as I've mentioned in the beginning, we're committed to continue supporting you in this process. So we've already established some of the kind of immediate needs. So perhaps what we could work on in providing as soon as possible is a list of immediate needs that could make a difference, as well as the cost associated to it, a preliminary list, and then work together for when it comes to the costing of the action plan.
Thank you for the opportunity to be here again. I think that Rodica is right, that probably to have a very conscious and deep analysis of what has been happening in the last 5 years and what should be the plan for the next 10 years, I'll say it, will take time. But evident is that we can do a rapid assessment that we have been doing these days, but we can do more in the next short term to identify what is a priority, because the priorities are very visible. You can see it, easy, not need to do any deep assessment of the situation to identify that the institute needs this and that in terms of radiotherapy, this is the need, in terms of early detection, this is the need, the most relevant. We have been not presenting every detail, but in the presentation that you will receive and the report you will receive, you will see that. Something that we can go with more little details in that to make it clear. But yes, it can be done in the very short term. Yes. Thank you.
Thank you. So my understanding is we can count on a list of immediate needs, and we can count on help with costing, but that will take a bit longer. But I mean, I'm looking at Ms. Gribik to make sure I'm not kind of imposing anything. If I just want to understand if it's available or not, and if yes or not, and so on.
Exactly. So for the basic needs, they are there, and the cost can be also estimated fairly soon. For the whole action plan, it will require a bit of time to do the costing for the whole plan.
Okay. You wanted to intervene?
Doar am vrut să adaug că, de fapt, exercițiul a fost de a susține Ministerul cu această evaluare, după care urmează să avem o bază de evidență scoasă pe platformă, inclusiv și a partenerilor care susțin, așa cum se face și cu platforma de needs assessment care se examinează de donatori. Știți mai bine decât, probabil decât noi la nivel național, cât potențialul de suport care este din mai multe instituții. Și atunci când sunt inclusiv și liste de medicamente sau echipament prezentate în timp, cred, rezonabil pentru a fi susținut în suport atât a refugiaților cât și a populației. Și mesajul OMS în tot procesul a fost că noi nu uităm de populația Republicii Moldova în orice direcție, inclusiv și în direcția cancerului, dar susținem și răspunsul țării în acordarea asistenței refugiaților. Dar ulterior și prin Ministerul Sănătății și prin dialoguri directe suntem gata să fim în contact, să vă furnizăm informație și să acordăm suportul care îl putem la maximum.
Ok. Thank you very much. Colegi, dacă doriți să interveniți?
Două, trei cuvinte. Da, stimați colegi, bună ziua! Noi, platforma parlamentară în Comisia, ne întâlnim cu reprezentanții OMS Moldova deseori pe diferite probleme și vă mulțumim că oferiți asistența constantă. Acum, în percepția mea, cel puțin, da? Cum se văd lucrurile, există realitatea situației oncologice în Republica Moldova, reprezentată prin statistici și prin cifre și prin trenduri. După care există o analiză SWOT făcută de colegii Institutului Oncologic, care este un centru științific, metodologic, didactic, practic și așa mai departe, și cu memorie instituțională, și de asemenea metodologic și cu sfaturi asistat de OMS. Respectiv, tot asta, logic, se regăsește într-un plan de acțiuni, care are acțiuni bazați pe parametri obiectiv măsurabili și termeni de implementare. Deci, cam așa este. Da? Și Comisia parlamentară oferă suport politic, încurajează, poate mai împinge din urmă, da? Realizarea și atingerea acestor obiective și oferirea unui suport legislativ. La rândul nostru, acum, în domeniul oncologiei, da, s-au făcut anumite schimbări, este o echipă managerială considerată nouă, care are ambiția de a schimba lucrurile și are un mare credit de încredere. Creditul acesta de încredere a fost oferit de către Comisie la vizita ei la Institutul Oncologic și eficiența acestei vizite s-a văzut imediat în colaborarea dintre Institutul Oncologic, Ministerul Sănătății, Comisiei la primele acțiuni. De exemplu, extinderea procedurilor dureroase care vor fi asistate anestezic în intervențiile ambulatorii sau în chirurgie de o zi. Deci, automat, noi avem o acțiune de umanizare a asistenței medicale. Acum, de exemplu, lucrăm și astăzi a fost înregistrat un proiect de lege care va permite extinderea categoriilor de pacienți pentru protezare după intervenții masive după tumori benigne, dar care au același impact anatomic asupra persoanei. Totodată, un proiect legislativ, tot cu mare impact asupra întregii țări, dar care neapărat va implica și Institutul Oncologic, este legea biobankingului, așa numită, da? Sau legea biospecimenilor, cum ar fi, care nu este reglementată. Deci, dar tot asta țin de anumite așteptări și problemele stringente, ele sunt de fapt la suprafață. Eu le listez foarte, foarte rapid. Una din probleme, adică ele nu țin neapărat de formalizarea în formatul dat, dar ele sunt aici, da? De exemplu, îmbunătățirea calității comunicării dintre medic și pacient, asigurarea echității și accesibilității lui la diferite servicii. Accesibilitatea la servicii de screening și de diagnostic și tratament. De exemplu, în special, transparentizarea accesului la investigații de înaltă performanță, la investigații costisitoare, la rânduri și așa mai departe. Da? Deci accentul pe screening este extrem de important. Din câte știu, sunt aproximativ 22 de tipuri de tumori care se țin la evidență, prin incidență, frecvență și așa mai departe, alți parametri, dar între care cel puțin 6-7 dintre ele se supun procedurilor de screening și de prevenție prin diferite metode. Și aici, de exemplu, necesitățile pot fi estimate foarte rapid. Câte colonoscope avem, câte colposcope avem, da, câte sisteme de test și așa mai departe, câți pacienți avem aici, estimările la necesitățile astea stringente pot fi făcute foarte rapid. Promovarea modului sănătos de viață, sunt alte programe și așa mai departe. Deci aici avem și chestiuni transversale, de exemplu, îngrijirile paliative, accesibilitatea la analgezicele opioide, terapia durerii. Astea sunt elemente de alte programe de stat, dar care au importanță și în situația dată. Cancer Registru, o inițiativă extraordinar de bună, dar din experiența sau din cele constatate în domeniul registrelor în general și informații numerizate. Dar nu este adică, automat, aici ideea este de a securiza datele, de a fi interactiv, de a avea o capacitate de backup și de a fi o proprietate a statului. Da? Că noi am avut doar experiențele recente că registrele plecau odată cu persoanele și ministerele rămâneau fără bază informațională și fără memorie instituțională. Deci, și aici, și eliminarea discrepanțelor dintre raportarea diferitor indicatori la diferite instituții de stat pe același parametru. Dacă are incidența la parametru X, o instituție spune o dată, altă instituție altă dată, altă instituție a treia dată, care este adevărul și în baza la care indicatorul a fost calculat. Deci, și evident că utilizarea rațională a resurselor alocate, inclusiv a celor umane și de timp. Deci, și în felul ăsta, după legea lui Pareto, 20% de probleme vor rezolva 80% din necesități. Cam aproximativ asta. Deci, dar noi ca și comisie și ca format de colaborare suntem foarte deschiși, direcți, spunem, și acționăm imediat. Mulțumesc.
Mulțumim, domn doctor. Doamna Grama, dacă doriți să interveniți.
Da, eu foarte repede. Dumneavoastră ați menționat în prezentare un lucru extraordinar, că persoanele refugiate trebuie să aibă acces identic la servicii de sănătate, inclusiv oncologice, ca și persoanele autohtone. Însă, în același timp, trebuie să recunoaștem că accesul pentru persoanele autohtone este unul mai redus decât ne-am fi dorit să fie. În cazul ăsta trebuie să creștem accesul pentru persoanele autohtone ca să fie un acces echitabil pentru toată lumea. Deci trebuie să recunoaștem că pandemia COVID a influențat destul de grav indicatorii de sănătate și în special depistarea tardivă a unor forme de cancer, ceea ce astăzi ne arată și cifrele care ne demonstrează. Un raport a ombudsmanului făcut anul trecut ne arată clar cum au fost afectate de fapt și indicatorii în oncologie urmare a pandemiei, fiindcă a scăzut screening-ul, fiindcă a scăzut adresabilitatea, fiindcă au fost alte priorități. Respectiv, astăzi noi, probabil deja ați aflat la Institutul Oncologic, sunt rânduri pentru pacienții oncologici autohtoni. Și atunci când noi pentru cei autohtoni avem rânduri, este clar că persoanele refugiate este o povară suplimentară asupra sistemului sănătății. De aceea, fortificarea serviciului oncologic este necesitate la nivel de țară pentru toată lumea. Vă mulțumim dacă o să fie ajutor.
Da, eu vă mulțumesc. Dacă dorește să mai intervină cineva, dacă nu, eu aș vrea să vă mulțumesc în primul rând dumneavoastră. I just want to make a very... Okay.
Thank you, Mr. Preciun, very much. I'm just thinking, just to clarify the point about hybrid approach to this theme. As Dr. Kessel was explaining, one direction is to transfer patients from Moldova to other European countries, and this is ongoing process. WHO is also involved in this one. And the other one, when it comes to requests for financial support for treatment, first of all, we need to know what are the costs, and this was the first step actually that we did to assess the essential medicines list needs and to estimate costs based on which we will know what is the cost that Moldova is asking for support. So I would say that these two processes are going in parallel. And from this stage, we can then proceed and see how WHO will support further in terms of financial support.
I fully agree that probably hybrid approach is the best. It will reduce costs and ease the burden on our own system. But as you mentioned, there are people who don't want to leave, want to stay here and receive it, so we probably need to see how we can provide it. And then the suggestion from Mrs. Grama seemed to me very pertinent about the post-reimbursement when we treat them first and WHO or someone else reimburses the costs later. And the costs are probably the same as they would be for a standard Moldovan patient receiving treatment. So it shouldn't be difficult to estimate, given that we already have regulated prices, what the national company pays for this treatment. So based on how many refugee patients have been treated, we can probably generate a cost. And then, based on that, the reimbursement would come. So my suggestion would be to take this discussion to the ministry next week and perhaps discuss it a bit more and more in depth with the national company, with all the stakeholders involved there, and decide if this reimbursement mechanism would be available, and then see whether funds would be available and proceed with some kind of solution to ensure treatment for refugees. Also, we agreed on a list of immediate needs. Would be very grateful if you could provide it at your time when it's possible, ASAP. It would be not a list of needs for the refugees, it would be a list of needs more for the Institute, from what you've seen and what you believe would be most cost efficient in terms of investments to ensure proper treatment. And then perhaps we can have more clarity and some timelines regarding the technical support for the external midterm review, when it's possible to be done and so on, and for the action plan itself, what kind of support and by when would it be possible to be provided to the Institute. Because with their own resources, they find it difficult, objectively so. So technical assistance would be much needed. And there's another point of discussion, maybe a bit more midterm, would be this idea about the National Reference Center for Cancer, which I don't fully yet understand what it would imply in terms of legislative changes, would be at a special status and so on. So that's perhaps something we can also discuss with the ministry, maybe with WHO, if there is experience like that in some other countries and what that involves, to kind of more strategically proceed with the consolidation and recognition of the role that essentially you are already playing. Yes.
Thank you. I would just like to stress one point of the affordability that you're mentioning for the reimbursement system. So that's just one component of access. And one thing that I find a bit concerning is the mismatch of information with what's established by the decree. When you say we thought we were providing care to cancer patients. Mm-hmm. I recognize that eventually I may have a language barrier, but what I read from the decree is not exactly that. So I think it's important just that you clarify this issue, because for refugees, they cannot be in a position where they are unsure if they have access or not. So they must know if they have access, and then the reimbursement system is another point. Of course, I understand that for you this is essential, sure, but for a citizen, in terms of human rights, they must know what they can count on.
I fully agree. We need clarity on that for sure. But as I understand, of course, more clarity is contingent on financial availability, and the way we will proceed will depend strategically. Do we want to encourage everyone to leave and get treatment elsewhere, or can we count on some support and then we provide it here? But I believe we will have to clarify this as soon as possible, and maybe we'll go to the ministry, invite WHO as well, and discuss these aspects in a different format. And Mr. Baltaga, if perhaps you want to draw some conclusions, and we will move so close. Okay.
Well, that's probably exactly, at least we've summed up the questions we have to move forward from here. It's obviously a long way, immediate needs and long terms. With regards to reference centers, our institute is doing a lot of jobs which is not in our organigram. For example, this National Program for Cancer Control, I see this as a part, like a position of a vice director. This is very important, and people are doing this job voluntarily. Then accreditation of our other institutions. We are a reference center. Our morphology, they see all, as a second opinion, all cancer suspicion cases, but that's not their job. This is one of the direction which we kindly and need the assistance. With regards to acute needs, we've discussed from initial that we could, in case we have funds and reinforcement of our capacities.
Thank you. And Mr. Vice Director.
Da, la final, dacă se poate, din partea Institutului Oncologic, vreau să aduc mulțumiri sincere pentru lucru efectuat în companie unei așa misiuni autoritare, cu așa specialiști notori, experți, și pentru ocazia de a ne expune în acest auditoriu și a discuta rezultatele. Vreau să spun că asistăm la prezentarea rezultatelor preliminare. Și cu răbdare și cu nerăbdare așteptăm și concluziile finale ale misiunii. Dar vreau să spun că unele scopuri deja au fost atinse. Deci, în primul rând, ceea ce ține de realizarea obiectivului 3 al Programului Național de Control a Cancerului și cu referință la tratamentele contemporane a fost discutat destul de amplu și am avut și pe slide aparte cu referință la medicație, la radioterapie. Vreau să menționez productivitatea discuției în grupul de lucru cu medicamente. Am avut ocazia să familiarizăm experții cu posibilitățile noastre, să primim chiar niște recomandări foarte utile cu referință prin prisma experienței lor, fiindcă sunt persoane chiar din domeniul nostru. Deci, și am discutat și pe marginea listei medicamentelor esențiale și prin marginea prioritizării unor anumite medicamente. Noi vrem cum mai bine pentru cetățenii Republicii Moldova și vrem ca arsenalul de medicamente, după cum am menționat și în discuțiile precedente, să fie cât mai bogat și cât mai reușit. Dar trebuie să știm, deci, posibilitățile noastre reale. Apropo, o mențiune, deci, ni s-a spus că bugetul, de exemplu, pe medicamente a instituției noastre este într-o corelare cu bugetul instituțiilor analogice de peste hotare. Însă, nu trebuie de uitat că instituția noastră este unică de acest fel în țară. Pretindem că trebuie să fim o instituție de referință, dar trebuie să avem și rețea, da? De instituții, ca să aibă cine să se refere la noi. Da? Foarte interesant a fost cu discuțiile în domeniul radioterapiei. Domnul dr. Rolando Camacho chiar ne-a sugerat unele idei foarte interesante. În discuția cu Comisia Parlamentară, dacă vă aduceți aminte, noi am menționat că am fost inaugurat un aparat performant de radioterapie și am spus atunci că la 4 milioane de locuitori trebuie să avem încă 2. Domnul Rolando ne-a spus că noi trebuie să avem încă 10. După lucru efectuat în cadrul, are dânsul o formulă foarte interesantă de calculare necesităților. Deci ne trebuie nu încă 2, dar 9 aparate de radioterapie. Necesitățile reale ale noastre care sunt. Da? Și noi acum nu simțim povara refugiaților, dar nu știm ce ne așteaptă. Da, în plină măsură, fiindcă majoritatea pacienților sunt redirecționați. Noi avem până la 10 pacienți tratați. Apropo, în cadrul studiilor clinice, că am preluat și o serie de pacienți din Ucraina, avem de 3 ori mai mulți pacienți pe care i-am luat din Kiev, din Odessa, din alte țări, deci din alte orașe ale țării. până la urmă, asta e situația, dar nu știm ce ne așteaptă pe viitor. Deci, asta e. Le mulțumim încă o dată și le dorim succes. Așteptăm raportul final.
Și noi vă mulțumim. Mulțumim mult Organizației Mondiale a Sănătății, ca de obicei. Sunteți alături de noi și ne ajutați și suntem recunoscători. Institutul Oncologic pentru toate efortul pe care îl fac. Responsabililor de program național pentru tot efortul voluntar pe care îl fac pe dimensiunea asta. Asta este de apreciat. Dar trebuie și de schimbat, în sensul că voluntariatul el are limitele sale, de obicei. Și celor de la minister. Și revenim la discuții, reieșind din prioritățile identificate astăzi și mizăm foarte mult pe ajutorul vostru continuu pe subiectul ăsta. Noi o să oferim suport politic necesar și o să încercăm să luptăm pentru resurse, pentru institut aici pe intern, dar asistența tehnică și dacă mai vin și niște asistență materială și financiară de discutare, întotdeauna o să miște lucrurile mai rapid. Mulțumim!
Mulțumim și dumneavoastră!
Mulțumim!
Mersi pentru primire!